Tony Colors, owner of Standing Ovation Entertainment and Ideal Weddings with DJ Tony Colors. You can find me at facebook.com/Tony L. Goins or on Instagram at instagram.com/DJ Tony Colors. But right now, you are tuned into the BRI, Black Research Institute, with the niggas, Denoris Wilson.
You deserve a standing ovation.
In the Black American reality, the people are presented with representations of real-life kings and queens through the medium of the Black Research Institute, BRI. These are their stories.
Hey guys, what's up? It's your girl Courtney from Charlotte, North Carolina, and you're watching the Black Research Institute with my boy Denoris Wilson.
Hey everybody, it's Courtney from Universal Success Consulting, and you're watching Black Research Institute with Denoris Wilson. Peace, love, and light.
What's up, everybody, and welcome to the BRI, which is the Black Research Institute, where we're here committed and we're solving the problems. My name is Denoris Wilson, the Negus. This is season 2, and I'm so very excited that we're back, and I thank everyone's for watching, tuning in, and maybe viewing this a little bit later. This is season 2, man, and I'm elated to continue doing this broadcast and bringing you Black royalty in its finest. And tonight I decided, well, not decided, but I thought that it would be best if we, talk about something that's affecting us all, which is COVID. Oh, excuse my pillow, everybody. I mean, I'm an old man. I need these pillows, man. But something that's affecting us all, which is COVID, right? So I have a friend of mine that I happened to cross paths with when I was at Southern Connecticut State University up in Connecticut. And she's a nurse practitioner, and she's been, on the front line. So after we run the second act and we come back, we're going to bring her back and talk about the next guest. But I got to say this. Welcome, everybody, to the BRI, which is the Black Research Institute, and I limited the sky. See, I try to merge entertainment with information, and the icing on the cake is a dope conversation. So ain't no time for the faking, debating, or the hating. I'm trying to hip you all to the moves they be making. They all struggle, but still find a way to make a way. Count stacks, fight back, stay black all day. So I seek to supply you all with inspiration, with information to remedy our present situation by showing you examples of Black royalty, and you never have to question my intent or loyalty. We're moving forward with the strength that's supremely kinetic, confident, Black, and unapologetic. Instilling self-love is what we really hope, but no doubt about it, Black people, we dope. Like I said, we dope. And coming up right now is a dope individual that's on the front lines fighting this pandemic that we're going through. I'd like to introduce the world and the BRI to Miss Natalia Black.
Hey, what's going on, Dolores?
Hey, Natalia, how you doing?
I'm doing well. Thank you so much.
Oh, you're very welcome. Thank you for agreeing to the interview and coming on. And
All right. No problem. No problem at all.
So it's customary here at the BRI that before we start the interview, there's a couple of questions that I gotta ask you. Right?
Okay.
I gotta ask you these questions. And actually one of the questions is gonna be funny, like considering your profession. So I'm gonna start with that first question.
Okay.
Are you being safe?
Am I? Am I being safe? I am being very safe. Very, very safe. I mean, you know what I do. I'm actually just getting off of work. I didn't even have time to get myself prepared here for this interview, but I'm being very safe. Yes.
Okay. So the next question is, are you happy?
You know what? I'm very happy. Very happy. Yes.
Well, since you're safe and you're happy, we can start this interview then. We can start this interview since you're safe and happy. That's all we can ask for, being safe and happy, right?
Yes, absolutely. Absolutely.
Okay, so before we get into the heart of the interview, tell the people a little bit about Miss Natalia Black.
Okay, so a little bit about me. I'm a nurse practitioner, as you know. I currently work for one of the largest healthcare systems in Texas right now. Actually, um, I I am in the pulmonary critical care and sleep medicine department of that healthcare system, and I specialize in sleep medicine as a nurse practitioner currently. Um, as you've already said, I went to Southern Connecticut State with you. That's actually where I got my RN degree, and I became a nurse practitioner here in Texas. So I've been in healthcare for a long time. Before becoming a nurse practitioner, I've been in healthcare 25 plus years. So that's, yeah. So.
Okay, so what's the difference between an RN and a nurse practitioner?
So RN, yes, you have to take a pretty significant test, what they call the NCLEX, to become an RN. You are a registered nurse. You're not able to prescribe. Yes, you have a scope of practice that's designated by the state that you practice in or the state that you reside in, mainly the state that you practice in. So you can't prescribe. You basically follow a doctor's order, a PA's order, or another provider's order like myself. So as a nurse practitioner, you are able to prescribe. You're able to do a lot of things as a nurse practitioner. You're pretty much, I don't like when people call us mid-levels. That's usually the term that's used, but that's kind of like what people refer to us as, or, oh, you're sort of like a doctor. Yeah, something like that. We prescribe, we do a lot of things, but the goal is the same, but the way we get to that goal is very different. I always follow nursing guidelines. And I say that because the foundation of nursing has never been about focusing on one single disease, one single disorder. We always have looked at the whole patient. Always, we never focus, even though my specialty right now is sleep medicine. I look at how someone's lack of sleep can affect their physical well-being as well as their mental well-being. So it's a holistic approach per se that nurses or nursing in general subscribe to. My specialty right now, what was that?
Go ahead, Natalia. You good?
Okay. I was like, I'm not sure what that is, but yeah,
Yeah,
so
that's it.
you,
A little echo. Go ahead.
okay. So, RNs, they can't really do that. They can't prescribe. They can't do the things that we do. We can't RNs cannot diagnose, they cannot prescribe, they cannot prescribe plans of care per se. But that's what we do. We assess, we have a plan of care set up, we prescribe medication, we reevaluate, reassess, all of that. So as an RN, I wasn't able to do that. And one of the things that made me become a nurse practitioner is because I wanted to do more for my patients. I didn't want to follow a doctor's orders because, in all honesty, sometimes I didn't agree with it. A lot of the times,
Okay.
actually. So, and I wanted to take a different approach to healthcare per se. Yes, I do believe in, Western medicine. I believe in prescribing medications, but the reason I became a provider is because I wanted to look at um, ways how to treat people without prescribing medication first. Like for me, prescribing is a last resort.
Okay.
So,
So with that being said, so let's go ahead and jump into the meat of the subject then, right? Let's go
all
ahead
right,
and just tear all off paper off. So
all
with
right.
what we're going through right now, and I don't know if there's any other course of fighting this pandemic or this virus other than vaccines, right? That's what they're pushing: vaccine, 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 right? And
Yeah.
I don't want to put you in a precarious position and ask you anything that was sort of, but why are they not telling us, like, okay, how to protect ourselves from getting the vaccine from getting COVID versus the mask and the 6 feet? Why are they not telling us anything that we can take, anything that they can, like, natural stuff? Why the doctors is not telling us, like, vitamin D or vitamin C or zinc, or like what's going on with that?
Because in all honesty, those things are not necessarily going to protect you from COVID-19. It's not necessarily
Okay.
true that that's going to protect you from COVID-19. Um, and And the fact of the matter is, the vaccine itself is not going to keep you from getting COVID-19 in general. It might allow you to get less severe symptoms, but it's not going to stop you from getting COVID-19. So let's be clear on that. The healthiest of people could be taking multiple supplements. I take plenty of supplements, plenty of natural supplements. Eat as healthy as I possibly can, take care of myself. But the thing about it that people don't understand with COVID-19 is that it's like playing at a roulette table. You never know what's going to happen if you get it. And I, for one, support the vaccine. I do support the vaccine because I see what it's doing in the ICU. I see what it's doing to my patients. Okay. In my healthcare system, when we have a patient one of our own patients that pass away, we'll go in and we log into the electronic health system, and it comes up and say there's a post-mortem report. So between the fact that in my department the pulmonologists are overwhelmed taking care of patients in the ICU, I support the vaccine. So, I
Okay.
mean, that's just me. I can't tell people what to believe. I know what I believe, and I do tell people definitely get the vaccine, because the population of patients that I work with, they're very vulnerable, very, very vulnerable. They're not well people. They are not people without comorbid conditions. They have morbid obesity that, that's on their diagnosis list. Okay, of course, sleep apnea, most of them, because they see me. They have COPD, they have congestive heart failure, so there's a multitude of conditions that they have. So I'm going to tell my patients that, hey, you could take all the supplements that you want to, but I'm not going to tell you that taking these supplements are going to keep you healthy. I'm not going to tell you that taking vitamin D, taking vitamin C, zinc, all the things that, to be honest, you should be taking anyway, are going to prevent you from getting it. These are like your everyday self-care things that you're supposed to do. But I'm not going to tell any of my patients that, hey, if you take these things, you're not going to get COVID. That would be irresponsible and unethical, obviously. So,
Right. So in essence, right? There's no real way to actually shield yourself besides not going
not
anywhere.
going anywhere. Stay in your house, and I'm being honest with you. Like, okay, so, on a personal note, let me share this with you. So last year, not only did I have to deal with COVID-19, okay, but I had to deal with something else, a personal health crisis of my own. And my doctor said to me, and, sometimes they might not have the best bedside manner. He said, you go outside and you die. I was like, you know okay, because he
Right.
he he called me. He did a video call. He did FaceTime. That was our He was like, he's looking, and he's like, where are you? He's Middle Eastern guy, and I'm like,
I would great say
i'm
he's
at
Indian, isn't it? I would great say that.
I'm out here, I'm at outside of Home Depot. Why? Well, he's like, no, you can't be out. I mean, he freaked the heck out. He was like, you go outside, you die. And I'm in the car like, I'm
Right.
going home right now. I'm
Right.
going home right now. And that's because I didn't have an immune system to fight anything with, because of what I was going through. That scared the heck out of me. So literally for 6 months, I'm looking out my window just like, oh, here comes Amazon delivery, and that's the only way. That is the only way.
Right.
I really could not go anywhere except to go get my treatments at the hospital. And I didn't even want to do that, because every time I thought about going, all I heard was, you go outside and you'll die. And I'm like, I don't want to take that
So,
chance. Who wants to take that
so,
chance?
so I got another question for you then. How do you think this is going to play out? How do you think COVID is going to play out?
Was that my computer? No, it's not mine.
No, you good. How you think COVID is going to play out? Like when it's all said and done, I know you can't give me a casualty like estimate, but what do you think is going to really happen?
So, what's gonna really happen is already happening, especially when it comes to the vaccine. It's going to be required. It's going to be required of certain healthcare providers that work with especially high risk populations. I know you've seen it in the news so far that there's a lot of healthcare providers losing their jobs, or resigning because they've chosen not to take the vaccine. That's unfortunate. I feel like they should have another option. I'm gonna say that that's unfortunate, because last year they were heroes, right? Last year they were
Right.
heroes. They were heroes, and now it's like, oh, take this vaccine that we have. But I feel like it shouldn't be like, okay, you're mandated to take it. It should be, get testing, at regular intervals, or
But
take the
but my
vaccine,
but
you know.
but my thing with that is you're mandated to take vaccines before you go to a public school,
That's
right?
true. And they're already
Like you,
mandated to take other vaccines like the flu and certain things like that.
right.
I
Like
do understand that.
so my thing is, if this thing is ravishing the world, not just our
Mhm.
country, it's the world, right?
Mhm.
Do you not think those nurses and all those healthcare professionals that decided to resign and not take the vaccine sends out like a strong message to the general population? Because
Th-
if the people who are administering the vaccine do not want to take the vaccine, it makes them it's like I don't know, Natalia. I
okay.
don't know.
So let me speak on that. Yes, you're right. It doesn't send a good message, unfortunately. And there's so many conspiracy theories out there about this vaccine. There are, oh my goodness, the amount of things that some of my patients tell me, some of my colleagues say to me, it's mind-boggling, honestly. And I think a lot of people, they just feed into it. But my job is to educate. My job is to honestly educate and say, you know what? You do remember, you do remember that vaccines aren't a new thing. Diseases like this that come and basically, kill millions of people are not a new thing. And what did scientists have to do? They had to come up with a vaccine quick.
Right,
Polio.
right,
Polio is one of is like that. Okay? People were lining up to get the polio vaccine. So it's because of the misinformation that is out there that is causing this problem. I I really think so.
but
That's
but
that's my
Natalia,
that's my
but
opinion.
but Natalia, people that work in the profession that you work in decided to give up that profession
Yes.
versus taking the vaccine. That's not a
Uh-huh.
conspiracy. That's not a
No, it's a
conspiracy.
conspiracy, I'm telling you. And it's
But
their
that
beliefs, it's their belief. It's
so
not a conspiracy why they're leaving. It's certain political beliefs. It has a lot
okay.
to do
So
with
so
it.
what you
These are my own
your
colleagues
peers, your
here.
peers,
These are my
your peers in
peers,
college,
okay?
right,
So
right.
these are things that they've told me. They've told
But
me. So
but
I'm
but
giving
this
you
is my
from that perspective there.
but this is my point. I'm not my point, but my issue rather, right? I understand you're giving me these issues, but you are a professional. You went to
Mhm.
school for this. You have
Yes, I
degrees for
did.
this. You have been training in this particular profession. Those people who decided to resign have been training in this particular
Mhm.
profession. So if I these are the people that we go to help us out when we're sick. These nurses, the nurse practitioners, we go to these people to help us out, and we expect them to know how to treat us, right? Now these
Mhm.
people, and this is the real sick thing about it. These people were willing to give us the vaccine, but when it came time for them to have to take the vaccine, they decided they would rather quit.
Yeah.
That is that to me,
It's one
either
of
they
those wow factors. It's like,
yes,
wow.
yes,
Wow.
yes. You can inject it in
Yeah.
someone else's arm. You can inject it in someone else's arm, but you don't want it injected in your arm. That's scary for me as a regular individual.
Yes,
That I
yes, and like you said, what it's really putting out there to the general public is it just
it's
makes things
crazy.
a lot worse. It just, because
Eh,
every day, every single day, I have to educate my patients because they come in and tell me one reason or the other why they are not taking the vaccine.
And
One
my
reason or
very
the
and
other.
and
So,
and and and, 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 and I'm mad at the media, right? I'm mad at the media for reporting that all these nurses decided to resign, right? Like they
mhm.
didn't have to report that. Like,
The media
but because
reports
we live in,
everything.
I know, but this is the thing that there are certain things that you just don't report until afterwards because the reporting of these things, even though it may be news, but it
Mhm.
hurts. For example, for example, if they said, you know, um, all these teachers walked out because there's asbestos in the schools that were built between 1970s and 19 whatever, but every school don't have asbestos in it. But because you put this out, parents are gonna take all their kids out of the school, out of all
Mhm.
schools, because you
Right.
reported this, right? Because you
Right.
reported it, right?
Yeah.
So, and my thing is that's why I wanted to have you on the show because, like, from what I've seen, I've either gotten a nurse practitioner, not a nurse practitioner, but a nurse or a doctor, and either they are for or against the vaccine, right? Like, so I get that, but no, don't. I need more than that, right? Like, I need more than okay, yeah, take the vaccine, or no, don't take the vaccine. I need more. I need more. Why should I take the vaccine? Tell me. You said because you see what it's doing to
Okay.
your patients in the ICU. Tell me why I should take the vaccine.
Okay. So, in terms of risk versus benefits, okay, in
Okay.
terms of the research, I decided to get the vaccine because of that. Because I'm not okay, let me not sugarcoat anything to you. At first, while this whole thing was going on and I'm sitting at home watching the news and, going on CDC website and reading about all this, I was like, I don't know. Let me find out more about this. Let me, read some more about this. I even talked to some of my colleagues actually because they're pulmonologists, they're pulmonology doctors, and they're critical care docs that, like I said, were working in the ICU. But there's a lot of misinformation out there, and depending on which news network you subscribe to, I'm gonna be honest, it changes. So,
Right.
you know, um, we have access to the actual research reports, actual studies. We have that at our fingertips so we can read this for ourselves if we choose to. And I chose to do that because I want to know how it's going to affect me. I want to know um, what's it going to do to my body? What's my risk of, getting a blood clot or something like that? Because that was an issue with I believe it was the Pfizer.
Don't mention. Don't do no names. Don't do no
No, oh,
names.
sorry,
Don't do
that
no.
was the issue with one of them, and
Right.
and that's another question I get asked. Which one do you think I should take? Which one do you think I should take? I'm like, honestly, I tell people do your own research when it comes to that. I'm not going to tell you which one to take or to not take, but do your research on the risks versus benefits. Do your research on, which one's best for you. I did my research and said, you know what? I'm not going to play like I'm at a roulette table when it comes to my life because I don't know how I'm going to be affected with this. And I had I took it. I had no issues with it. I heard of people feeling sick for a little while, like they had the flu or they had some kind of upper respiratory issues, but I had no issues with it, none whatsoever. Matter of fact, getting the flu shot that I get on a yearly basis was actually worse than this. So, um, you know, for me personally, I would say, look at the research. Look at the research, especially if you have comorbid conditions. My patients come to me and I say to them, look, you have this disease, you have this disease, that disease, and you're morbidly obese. Do you want to take the risk and see what the outcome is? Do you want to take the risk of getting COVID-19 and seeing what that outcome is. It's up to you.
A question just hit me. Have you seen like a perfectly healthy person, like someone that works out and healthy, don't smoke cigarettes, don't do anything? Have you seen them die from COVID?
Multiple. That's the
Die from
scary part.
COVID?
Die from COVID. That's and that's what's so, and that's why I always compare this to the roulette table in the
Like
casino.
in shape,
In shape. In shape. I'm talking about someone that, avid gym rat, pretty much. It's really sad. I mean, and that's when I think I got really, really kind of, like, okay, let me really look into this a little bit more. Because when you start seeing people that are healthy, no issues, they don't take anything besides supplements and eat healthy. Eat organic everything.
So wait a minute though.
Go
So
into the ICU and die. That's unimaginable.
So a question though, right? So the virus really attacks your respiratory system? Okay, so
It's your respiratory
even
system,
though they may appear to be healthy, their respiratory system can still be compromised, right?
Yes, it could be compromised already,
and they don't know it, and they
have
don't
no
know
idea.
it, right? And they don't know. So
it could be compromised already, but I've had people that are avid runners, marathon runners. Obviously, their respiratory systems are not compromised, and they've actually met their demise from COVID-19. So
you know what I kind of think though. I kind of think like and I think about this with any type of virus or disease, right?
Mm-hmm.
All right. So everyone is unique, right? Everybody's unique. There's not one person on the planet that is not unique. Everyone is a one of one.
Mm-hmm.
Right? But
that's true.
And even in that uniqueness, we still have certain things that are alike in us, right?
Mm-hmm.
And those certain things that are alike in us, I think like when certain environments or climate change or whatever, some of us it may trigger in, and some of us it may not, right? Like for example, I don't get sick, like as a cold or anything like that. I do not get sick, but people around me do. But I don't really get sick. I'm not saying that I'm blessed. I just think like that's just part of the human DNA cycle or whatever. But I think like COVID, cancer, HIV, I think like in certain people it just gets triggered. Like for example, we all have cancer cells in our body, correct?
Well, not necessarily. Yeah, because it's our own cells turning against each other.
Right.
So yeah.
Right. So we all have the possibility of that, right?
Mm-hmm.
But in some, it gets triggered to be cancer.
Yes.
And they don't have to smoke. They don't have to do anything. It can just.
That's true. That is true. Right. It could be genetics. It could be environmental. It could be a lot of different factors.
A lot of things that
environmental. Yeah.
And I segued to that because I know what you went through last year. Mm-hmm. Like I know exactly what you went through last year. You didn't mention it, but I know, right?
Yeah.
I know exactly what you meant. I know exactly what you went through last year, and I don't know if you want to share it, but if you do,
I can share it. I can share it. That's going to be, we're going to, we talked about doing a whole nother. Okay, so
we'll save it.
Yeah, we're gonna save all that. We're gonna save all that. But I can just mention. So I was diagnosed with breast cancer December 2019, And, in the midst of this, I see in the news that they're talking about this COVID-19. It wasn't as pronounced right then, but in 2020, I had surgery and then found out I had to have chemo in the midst of the pandemic, the midst of the shutdown, all of that. So, that was a whole nother experience right there on its own.
Right.
Going through breast cancer, going through treatment during a pandemic, that was an experience. That was a whole different experience right there. When the provider becomes the patient, that was a whole experience.
Well, that whole experience will be chronicled in the future, what we talked about. But look, Natalia, let's take a short break. Let's take a
Okay.
short break, and then we'll come back. Okay.
All right.
All right.
Hey y'all, it's your girl Star B, and you're tuned into BRI, the Black Research Institute with Brother Dolores Wilson. I hope you continue to enjoy the show. Just try not to get caught up. Way back we were everything. Must not be listening, deaf, dumb, and ignorant. You must confuse me for a codependent. I cannot lead you to think that I need you. Can't trust these niggas, can't trust these bitches. I don't know why you think you're any different. I can't trust if what we get is love. You send mixed signals. Why you keep using these symbols with me? I feel so uninspired. Let's discuss this before I go tired and leave. Keep it a stack, keep it real. I don't wanna play the guessing game. We just go back and forth, argue about everything. Don't you think I'm tired? For your love, baby, this is not a wrestling ring. But choice for what you have, 'cause if I leave, this gon' be the greatest go up ever. Throw on the red bottoms and the freakum dress. I just want the sex, I don't want the stress. I just want the neck, I don't know what's next. I built walls of respect that you can't overstep. Now I overstand. Love like this, you gon' be lonely as an older man. You kept your feelings for me hidden like your poker hand. Then you threw dirt up on my name with the overhand. So now I'm on the road again. Tuck down the breeze, close my interwoven strands. I wrote about all the shit that we would undergo firsthand. And now the way I feel for you is I don't know again. So now I'm on the road again. Tuck down, the breeze blows my interwoven strings. I wrote about all the shit that we would undergo firsthand. And now the way I feel for you is I don't know again. You send mixed signals, why you keep using these symbols with me? I feel so uninspired. Let's discuss this before I grow tired and leave. Keep it a stack, keep it real. I don't wanna play the guessing game. We just go back and forth, arguing about everything. Don't you think I'm tired of fighting for your love? Baby, this is not a wrestling ring. But choice for what you have, 'cause if I leave, this gon' be the greatest glow up ever seen.
Okay, we're back. Hey, Natalia.
Hey, Denoris.
That video was I had the young lady on my show about a couple of months ago, and she told me when she dropped her new video that she would, send it over to me so I could premiere it here. It premiered actually yesterday. Her name is Star B. She's from Baltimore.
Okay.
It premiered yesterday, and I'm premiered on our show tonight.
I was gonna ask you about
But
that.
but I want to ask you something.
Sure.
I know, right? Right. I want to ask you something, right? So with this COVID thing and with the vaccine and the mandates, like let's say you run into a patient and they don't want to take the vaccine. What are some of the things that you can tell them to do? Not necessarily that to protect them from getting COVID, but just some basic things that you should be doing, like you said, you should be doing anyway. Like let's take COVID off the table. What should you be doing anyway in regards to supplements and keeping yourself healthy?
Okay. Well, in regards to keeping yourself healthy, I'm a big believer in water. I don't go by the eight glasses, 8 glasses of water. I go by half your body weight of water. That's what I feel your real intake should be, because, a lot of us are chronically dehydrated and not even aware of that. That definitely just affects so much in our body. I believe in, making sure you're taking vitamins, natural vitamins. I'm definitely a big believer in that. Vitamin C, zinc. At the first time that you notice that you have a sniffle, a sneeze, anything like that, this is something I do for myself as well as my son. I make sure we're both taking supplements. We're both taking vitamin C. What's that called? The emergency. We take that a lot. Take emergency a lot. Because where we live here in Texas, there's a lot of allergens here. Of course, air quality everywhere is not the greatest, especially in the U.S., but here in Texas, it's a pretty major issue, So I definitely tell my patients to increase their water intake, decrease certain type of fats they're eating. Make sure they're eating a lot of things that come from the ground, eating a lot of things that come from the ground, a lot of things that grow up, So of course, no one wants me to say this, decrease your meat products, but I think that's really important.
But a cow grows up
from the ground, out the ground, in dirt, in dirt, in dirt. Don't try that. Don't try that.
I'm
Okay.
just saying. You said things that grow up. A cow grows up. I don't know. I mean, I love beef.
No, I'm not saying do not eat beef. I'm not telling anybody do not eat beef, okay? But make sure you're getting a significant intake of green, leafy vegetables, things that grow from the ground. Heck, if you can grow it yourself, that's always the best. Just
Right.
saying.
Right.
You know where I'm from. You know where I'm from originally. So I believe in things that come from the ground that grow out the dirt.
Okay, so the people here don't know where you're from originally.
I
So
am from the
what? Wait
island
a
of
minute.
Jamaica.
Hold on. Now, what
No,
you said about eating things from the ground, right? Say that in patois.
don't put me on the spot like
No,
that.
say it.
Don't do it. You see, you always try to do.
Say it. I want to hear you say it. You can say it. I know you know how to say it.
You
Go ahead
know
and say it.
I do, but come on. You're not Jamaican. You always
Listen,
trying to put me
listen.
on there.
I saw Steven Seagal, and I love White Boy Hatcher. I love who done it. White Boy Hatcher. Da did it. So
I'ma
come
need
on,
you.
just say
I'ma need you.
eat food from the ground.
Eat the things that will come from the ground. I can't stand you. I can't stand you.
Yeah, I got her to do it. Yo, every time I saw you at something, then I always ask you to
Always,
I
always.
always
Black
ask
Student
you to
Union,
talk.
all of that. I'm telling you,
It
still getting on
fascinates.
my nerves.
It fascinates me that like y'all understand one another. Like I no lie, it fascinates because when I was in because Southern had a significant Jamaican presence.
Yes, we did.
Significant,
Represent.
significant Jamaican. And when y'all get around each other, y'all to me it sounded like Spanish. Like I
Yep.
don't know.
Yep. And I'll be talking to you just like this. I'll be
Right.
talking to
And
you
you
just
turn
like this.
around.
And then
Yeah. And then
you be
turn
standing
around
there
like,
like,
what part you doing? I'm like, what
what
the hell?
what just happened?
But,
I
but Natalia,
remember.
I told you before, I'm very proud of you. Um, I'm honored to be considered a friend of yours.
Same
Thank you for
here.
being on the front lines of this pandemic and helping people and informing people. And we talked earlier today and you told me that you're about to branch out. You're about to spread your wings.
I'm spreading my
Um
wings, man. Yes. Got to.
and and one thing that I always used to try to say at the Black Student Union is that you got to keep going up. Up is the way. Like you got to keep going up because the moment you stop going up, you're actually falling.
Yeah. Yeah, you're
Right.
right.
And
You're right.
the moment you stop going up, you're actually falling. And you've been going up ever since you left the school. So keep rising. Keep
Yes.
rising, man.
Yes. I
And
gotta
and
branch out. I mean, with this whole honestly, this pandemic, this whole situation that has gone on this past couple of years showed that there was a need for me to branch out.
okay.
There's a need for certain services, and this is the perfect opportunity. This is the perfect opportunity for providers to branch out and provide these services that people so desperately need. There's a lot of people that were homebound before the pandemic. Now they literally can't go anywhere. So,
Right.
there is a need to branch out.
So do you think that there's going to be another government shutdown?
I I think there will be. That's just an opinion. That's just an opinion. That's not fact, okay? That's just an opinion of mine, but um despite what I think, healthcare goes on, you know.
Right.
People are sick every day. People need healthcare every day, 24 hours a day, 7 days a week. It does not matter. So, at the end of the day, regardless of what shuts down, healthcare providers can't shut down. We do not shut down. We still have to take care of sick people. And, it's so funny that, um, I'll talk to my sister, I'll talk to my friends that are nurse practitioners, and we'll say that, man, it's my day off. If something happens, I'm making sure no one knows that I'm a provider. We lying. We lying. The minute something happens, we're like right there. I was at the airport a couple weeks ago, and someone just fell on their face and had a seizure. And I was really thinking to myself going to the airport, like, I'm tired. I'm just trying to get some rest. I'm trying to go take a trip. As soon as this man fell, I'm jumping over tables and stuff, trying to get over there. So I'm like, why do we do this? Because it's in us. It's in us to do it. That's what we do.
I think there are certain professions, right? There are certain professions that, even though they may be your profession, they're actually who you are,
Hmm.
right? Like they may be the work that you do, but they're actually, like, a teacher is a teacher.
Hmm.
There's a teacher is a teacher gonna teach, whether it be in
That's
a
true.
classroom or not. A teacher is gonna teach, and that's her or him or whoever it is. And I think the
You're
same thing
right.
with a doctor. I think the same thing with a nurse practitioner. Like, that's
Hmm.
who y'all are. Like, it's
Hmm.
not something, because let's keep it real. It's not the most glamorous job, right?
No,
It's not glamorous.
no.
Um, I mean, unless you get a TLC special or a Bravo special, it ain't a
Hmm.
whole lot of money in it, right? You ain't making a whole lot of money doing it. Um, and you're dealing with people who are in pain, so therefore they're very nasty, like they're
Yeah.
nasty, right? Because
They're
they're
yeah.
in pain,
Yeah.
right?
And
Because they're in
and
pain.
they're in pain, and they sometimes they just lack an understanding. They lack some understanding. There's many times that I've had patients, they've come to me and I explain things to them differently. It wasn't explained to them that way before, because I bring it down to a level that they can understand it. I'm with my patients, I don't go in there like I know everything. I'm like, look, I really talk to them just like, look, do, do you understand this? Tell
Right.
me what you understand, because I want to hear this from you. And let me take it from there. But I want to know what you understand about this. Okay?
Right.
And the things that I tell them, I'm going to be honest, my patients say, you scare me, some of the stuff you say. I'm like, well, yeah, that's the point. That's the point. Because
Right.
the things that I'm telling you about, they're no laughing matter. They're no laughing
Right.
matter. So I want you to have a sense of fear of what can happen.
Hey,
So,
one of the good things about living in the country that we live in, and it's also a bad thing, is that the freedom that we have, like the freedom that we have, is a double-edged sword, right? Like, it's double-edged. We have freedom to be able to do what we want to do. We can do what we want to do. We don't have to take the vaccine. We can take the vaccine.
mhm.
We have that freedom to do what we want to do. But at the end of the day, that because we are facing a virus of this magnitude, if everybody ain't on the same page, it ain't gonna matter.
Yeah. Yeah, that's the unfortunate part. That's the unfortunate part. And that's the question that looms, how do we get everybody on the same page? How
If
do we
everybody's not
actually,
on,
how do we get everyone on that same page? That's the question, but who's going to answer it? How do we even
see,
answer that?
see the problem with that is that Okay, so you remember when the swine flu took over? Well, you don't remember, but you
I
read about
do.
it.
I do. Wait, no, hold on. Yes, I do.
I, okay, wait a minute. I'm mentioning the wrong one. The bird flu. Before you and I were born. Before you and I were born, they had the bird flu that was out, right? But because healthcare, nothing was politicized back then. We were still trying to grow into the America that we are today. So we did a lot of things together. So those people, I saw pictures where people back then, they were wearing masks. Everybody was wearing masks. Everybody was involved. And we got through that bird flu. But now, because everything is so politicized,
Politicized. Nail on the head. Nail on the head, Denoris.
It's so politicized because everything is so politicized. It's divided right off the top. Right off the top, it's divided, and that right there, we have the freedom to choose whichever way we want to go. But at some point, we gotta say, whichever way we're gonna go, we gotta be going together.
Together. That's right.
Because some can't get vaccinated and some can't. Now, I'm not vaccinated. I'm gonna be honest with you. I'm not vaccinated yet. I'm not vaccinated. I don't take the flu shot, right? Like I'm not vaccinated, and it's not that I'm scared of the vaccine. I'm not scared of the vaccine. I'm not scared of COVID either. But I'm kind of treating the vaccine like I treat the new iPhone. Once it come out, I let all the bugs get worked out, and then I go get it. Right, like I mean, I'm telling the honest God truth.
I'm gonna treat it like the new iPhone.
Because I don't go anywhere anyway, right? So I'm not in contact with a lot of people on a daily basis. So I don't go anywhere. I'm not saying the vaccine don't work. I'm not saying it does work. I'm not saying anything like that. What I am saying is, once you get all the bugs out, right? Once you get all the bugs, I'm gonna get my vaccine.
Okay.
Because I think right now, everyone that's getting the vaccine, they are a part of the trials.
So let me say this. Okay. I do not think there will be a time where all the bugs are out. Okay.
Wow.
I'm being honest with you. Because this is a virus. The flu shot. The flu is a virus, right?
Right.
Every year they have to come up with a different type of flu shot. This is gonna be like that. I feel like this is what it's gonna be like. So it's never gonna be okay. We've got all the bugs out and it's perfect. It's never gonna be perfect.
So we're gonna have a COVID season. Okay, I can see that. I can see that
because my goodness. Now what do we have? Delta. We have the Delta variant. That's the issue now.
There's a moo
there is, but what my the pulmonologists that I work with, they're dealing with, and thank goodness the numbers are starting to go down in the ICU. However, what they're dealing with is that Delta variant right now. I've heard of these other. I'm over it. I'm going to be honest with you. I am so over. I'm over it, but I think that's what's going to happen. There's going to be different variants. It's like it's just the virus just mutates. So it's going to be a constant challenge for the scientists to come up with something to fight this.
You know what it reminds me of? It reminds me of HIV. It reminds me of HIV, man, because you remember when I left Southern, I was an HIV counselor, and it startled me to know that if you are on HIV medication and you stop taking your medication for a week, 2 weeks, it don't work no more.
Yeah.
right? Like
Yeah.
you got to get up, you got to get something else because that medication don't work no more.
Yes.
And it
The
startled,
virus, yeah,
me.
replicates.
It
Yeah.
mutated. It replicated and mutated
Mutated. So.
to fight whatever it is you would,
Mhm.
and that startled me, right? It start because it's using you to kill you.
Yeah.
Right? It's
Yeah.
using you to kill you.
Yeah. I mean, I'm telling you, science, I believe in science. I believe in a lot of things, but as a provider, I feel like you have to believe in science, and it's amazing.
Right, right,
There's so
right.
many things about science that blows my mind. I'm like, this is crazy. Like, for instance, I still can't get over the fact I was telling you about the whole cancer situation. I'm like, my own body's here
Yeah,
trying to
you don't
kill me.
smoke. You don't right. You don't smoke. You
My
don't
own
do
body.
none of that.
Yeah, you could do, and so here's another thing, doctors don't know everything, providers don't know everything. So genetic testing, that there's, some genetics to breast cancer. I have a sister that is in remission from breast cancer. My mom died of breast cancer. Guess what? We don't have the gene.
The gene. Hey, but you know what, Natalia? You
So,
know what? You know what I realized? Like, you are a nurse practitioner, and doctors, they don't have an office or a job or a company. They have a practice. It's called a practice. And I know this.
oh
I know
God.
this is a play. I know that this is a play on words, but it's a practice. It's a practice. That's what they have, a practice, meaning that they don't know everything. Like they don't, and that's why I sort of give all these scientists, not give them a pass, but I understand because you don't know everything. And this is something new. This is something totally new that's out in the world. So there are no experts on this. There are
Right.
no experts on COVID right now.
No.
None.
No.
So I understand how hard it is for you to come up with a remedy that will suit everybody. 8 billion DNAs in the world. I understand that, right? I also understand that what you are telling me as a nurse practitioner is the best information that you could have found in regards to this particular issue that I'm having. It don't mean it's gonna solve whatever it is I'm having. It just means you giving me the best information that you have researched and found to help me.
Exactly.
Right? But what people do with people like you, if you tell me something, then I'm supposed to get better.
Yes.
Like
That's the expectation all the time.
Mm-hmm.
That's the expectation all the time. And I find myself telling my patients, look, especially initial consults, I tell them, let me just tell you this, okay? Never said I'm going to fix you. I said I'm going to do everything I can to help you.
Right.
Okay, I'm going to do everything I can to help you. But first, let's find out if this is the problem. Let's do these tests. Let's rule out what we can. Because, in school, they teach us about something called differential diagnoses. Differential diagnoses, these are things with similar symptoms. Okay, so it could be this, that. It could be a whole bunch of different things because the symptoms are the same. Okay, so I always tell my patients, I'm here to help you. I'm here to help. I'm not here to fix you. I'm here to help you figure out what's going on. Can't guarantee anything, but I'm going to do everything I can to help you.
Okay, Nurse Black.
That's what I do. That's what I do.
Hey, look, you came a long
I
way.
know, man. I know. I was looking at some pictures that my roommate, my college roommate, you remember my roommate, put up I could not believe those pictures. I was like, oh God.
Hey,
But
but
yeah.
I told you before. I always envision you being in corporate America. I told you that. Like you,
Yeah. Yeah.
I told you. I've always envisioned you being in corporate America.
I might still get there. Wait a
but this
minute
is sort
now.
of
I might
corporate
still
too.
go
You,
there. I might still get
look, this
there.
is you still wear a formal suit to work, so it's corporate as well. But Natalia, I'm trying to stay on point with my timing, so we're 5 minutes older. But I appreciate you coming on here, and I hope that the people that listened got something from it, because what I got from it is that, look, you're doing the best that you can as a nurse practitioner to help people understand COVID and what they can do as far as combating it naturally and taking the vaccine. And you recommend them taking the vaccine,
I
right?
do.
It's,
I do.
and it's not many nurses. Trust and believe, there's not many nurses that will come on record and say this. Right? If you look at the news, if you look at all the reports, you haven't heard a nurse say, take the vaccine or don't take the vaccine. Or, you may see a commercial with someone getting their shot in their arm, something like that. But actual interview and listen to someone that's been doing it, like, I'm still not going to take the vaccine anytime soon. But I have a little bit
Yeah,
more
we
confidence in
gotta
the vaccine
wait till the
because of you.
iPhone is. We gotta wait till the
Right.
iPhone is
So the bugs
perfected.
are out. So
But
all the bugs are out.
I tell people this. I'm giving you the information based on what I'm seeing and what I know. And one of the things that you said that's very important. We all have to be going together. One group can't be going this way, the other. This is not going to work. This is not going to work at all. And that's the problem we have now. There was a time, there was a certain time before November 7th, was it? Where so many people was all about, getting this vaccine. And January, that changed. January, that same group of people changed. Okay.
Hey, hold on, Natalia. We don't do politics over here.
We're not doing any politics. I'm just
Right.
saying this is based on what I see. This is what I've
Yeah,
seen.
yeah.
This is
And
my
you in
group of
Texas too,
people.
so
I'm in
you in Texas, so you
Texas.
see it. You see it a lot.
I'm in
Yeah,
Texas. Okay.
yeah,
I'm in Texas and I work with groups of people.
right.
I work with certain groups of people.
I know.
That 1 minute, these are my colleagues, these are my peers that they were all about the vaccine. And literally now they're like, well, I don't know what I'm going to do because I'm not taking it. Wait, but you've been waiting for this to come out. What are you talking about? You're not taking it.
Hey, I'm gonna say this to you, and on that issue, and say this. I'm just gonna say this and leave it alone because I don't really like doing this, but I'm gonna say this. When a group of people can see like no wrong in keeping another group of people in captivity for 250 years, right? They can see no wrong in it. It doesn't need justification. It doesn't need any type of saying I'm sorry or it doesn't need anything. There's nothing wrong with it. That's how it was back then. If a group of people can say that and see that, then nothing that they say surprises me. Right? It doesn't surprise me. So my whole thing is I bring you up here to educate the people and let them know that, look, you're not just someone who just out in the public eye. You're on the front line. And Texas was hit hard, like really, really hard. So you're on the front line. So this is like
Still being hit hard, Denora, still being hit hard, because as this second wave, as they've called it, There's some states, there's only certain states that have been hit very, very hard by it. So, and my state is one of those states, and my hospital system is being hit very hard. The doctors I work with, they cover multiple hospitals, multiple, not only within my healthcare system, but they cover other smaller hospitals in the area. So these physicians are tired. These ICU docs they're exhausted. So, seeing it from that perspective, I have a different outlook. I
Right.
just seeing it
Right.
from that light. I mean, how can I say no? Don't take the vaccine. Just believe what you want to. I have to tell these people. I'm like, looking at looking at what you have going on with you, I would not tell you to risk your life like that. That's what I
You
tell
know
my
what bugs me out?
patients. Don't risk it.
You know what? You know what bugs me out about people who are anti. I'm not anti-vaccination, so let's get that out of the way. I
Mm-hmm.
am not anti-vaccination. I'm just saying I'm gonna wait. Right. That's all I'm saying. I'm not anti-vaccination. I'm not telling no one not to get it.
Right.
What bugs me out? What bugs me out about the anti-vaccination people is that you're not saying that the vaccination is killing you,
Mm-hmm.
right? You're only saying that the vaccination doesn't help you from getting COVID.
Right.
You're not saying that it's hurting you. You're not saying that it's
Right.
harming you. You just saying that it's not helping you from getting COVID. Like, so to me, it's like if I go to the hospital and they say, you got to take this pill or, you're going to die or whatever, right? Now the pill may not, it may not kill me, but it has a better chance of helping me not dying.
Exactly.
Like,
Yeah.
so like I said, I'm not anti-vaxxer. I'm not an
Mm-hmm.
anti-vaxxer. But so when I say I haven't taken the vaccination, it's because I think I'm trying to be smart, right? Like that's what
Mm-hmm.
it is. I think I'm trying to be
Mm-hmm.
smart about it. But I'm not an anti-vaxxer.
Mm-hmm.
Um, and I tell people, like you tell people,
Mm-hmm.
like do what you think is best for you. Like
Yeah.
do what you think is best for you. But no, don't get mad at nobody else for not doing what you think is best, right? Because they got their own life just like you got your own life, right? So if and my thing is, if you are vaccinated, why are you really worrying about somebody who's not vaccinated, right? Like, and I understand because, like you said, if you are vaccinated, that doesn't stop you from getting COVID,
Mm-hmm.
right? So that may be the reason why people who are vaccinated are still upset with people who are not getting vaccinated because they can still get COVID too, right?
Yes, they can. They can still get COVID
Mhm.
as well. And from the perspective that I'm seeing it, you're overwhelming the healthcare system.
Okay.
You're overwhelming the health. That's what I'm seeing. There are, we haven't even touched on that, Denoris. We haven't even touched on what's going on in depth. ICU beds are being filled up with COVID patients there's 94% of the beds that's taken in the ICU are patients that are on ventilators, that they have COVID. There are other people that need these beds. People that have been in motor vehicle accidents, people that, for whatever, they have some other acute respiratory failure. There's other people that need these ICU beds. So think about it from that perspective. It's not that the vaccinated people are here, saying, oh, you shouldn't get vaccinated. You should get vaccinated. It's like, look what you're doing to our healthcare system right now. Okay.
You
Healthcare
trying to make
provider
me feel
here.
guilty.
No, I'm not. I'm telling you the truth. as I see it. Okay. I see what's going on. Every morning, I turn on my computer at work. It tells us the percentage of beds that are full and the percentage of patients in those beds that are unvaccinated COVID patients. So that's what I'm looking at. Okay. Because do you want to be one of the people that need the ICU beds? But guess what? There is none because
Well,
we got to take care of these COVID patients.
okay. Yeah, true.
They weren't vaccinated. We can't say sorry. We can't say sorry, you didn't get your vaccine. So we're not going to admit you. We're not going to vent you. We're not going to put you on a ventilator today. We can't do that.
Right.
So it's kind of like first come, first served right now. And it's
You've given me some,
unfortunate.
you've given me something to consider in regards to this vaccination because I'm a veteran, so I can go and get it like that.
Yeah. Yeah.
Right.
It's
But
it's
Natalia, if I go get this vaccination and I get another finger, like it's gonna be on like really, really between me and you. If I get another finger like right here, like another finger that grow out of my what's the name?
so I'm just saying, like, what would be wrong with an extra finger? You know? I mean, I'm
What
just
would be wrong
saying.
with?
I'm just saying. I was like, not for
You? Oh, so
nothing. If
you?
I grew another arm, I mean, man, being a single parent, working and everything, I was like, that arm could help me out. I'm just
No, you wouldn't want no other.
let me stop. No, see, you got
But
me. No, but you ain't gonna grow
right,
no
but
other
it's
finger.
right.
People,
I'm just
you're not gonna.
look. My mom talking about you got him, amen. But listen, I appreciate you again. I appreciate you for coming up here and sharing. And we got a little bit more for the people in the future, don't we?
Yes, we do. We got a lot more. We got some things to
Yeah,
talk about.
yeah,
We got some
we
things
definitely
in
do.
the works right now that I definitely want to talk about because this whole experience for me last year opened up a lot. So when you get to see from the inside, from the patient's perspective, it's different. It's
Right.
different. It's
Don't
real
give it
different.
away. Do not
It's
give
real
it away.
different.
Do not give it away.
I just
But
said
yeah.
it's different. It's different.
Yeah. Okay,
We
so
have a lot to talk about.
yes, we do. But tell the people how they can get in touch with you or follow you because I didn't get a chance to air your promo today.
Okay. So give me a minute
You don't
here
even know. You
because
don't even know. I tell them
I
because
know,
you know.
right? Oh, don't play with me. Listen, I don't got time for that. I'm like, can you just put it up on here
I'll
somewhere?
put it.
Cause
I'll put it up. I'll
I'm
put
like,
it
hold
up.
up, let me find out. I don't know. I really don't. I gotta
I'll
look it
put it.
up.
I'll
'Cause-
put it up at. I'll put it up at the end of the
but I'm
show.
on
So
Instagram, on Facebook, y'all.
just look. All they gotta do is type in Natalia Black. That's it.
That is true. That is
That's
true.
it. That's all
That
they got.
is
That's all they
true.
gotta type in.
Yep.
Natalia Black.
Yep.
But
Nat the
Natalia,
MP. I know the Instagram one. I know the
yeah,
Instagram one.
the
Nat the
MP. Yeah,
MP.
yeah. But Nat, I'm gonna end this show and I'm gonna end it by saying thank you. Keep up the good work. I'm proud of you, and we got a lot of work to do. So
Yes, we do.
um, I appreciate you. You've given me a little bit more insight to what's going on, and not necessarily the scientific or the science behind it, but the effect of it, right? The effect of what's happening. And
Hmm.
you ain't got look, you ain't got to know the science to understand the effect, right? You know what I
You
mean?
don't really,
You ain't got to know the
you
science
don't.
to understand the effect. So thank you, and I'm sure the viewers appreciate you as well.
Well, thank you for having me on. I appreciate this opportunity and I look forward to our future endeavors together.
With that, I say peace, Nat.
All right. Thanks. Bye-bye.
I'll call you tomorrow so we can discuss what we got to talk about. All right.
All right. All right. Take
All
care.
right. Thank you, Nat. Everyone, Miss Natalia Black.
Bye-bye.
So, everybody, that was my friend Natalia Black, and she is a nurse practitioner out of Texas. She's still trying to get rid of all that stuff. But anyway, I appreciate her, and I appreciate you for tuning in to the premiere show of the season 2 of the BRI. I'm trying to stay on point. I ran over, but thank you for staying with us, and thank you for viewing with us. And as I always do, remember, in order for you to receive a blessing, you must first be a blessing. All right. And with that, peace.